All right, thank you, Brad. For this Black History Month, WCNC Charlotte is highlighting the racial disparities in society which remain drivers of inequity. This week, we are focusing on health care. And as you're about to see, the issue of institutional racism and other factors can create differing health outcomes for Black and white Americans. WCNC Charlotte's Sarah French explains.
Let's start with the diabetes debate. Diabetes is a leading cause of illness and death in the U.S. But a study published in the Journal of Urban Health compared disparities in diabetes mortality across the largest U.S. cities. Let's zoom in on Charlotte. The study published in 2014 showed the mortality rate for whites, who made up more than 50% of the population, was a little over 16%. But the rate for Blacks, who made up 33% of the population, was more than 38%. The study confirmed Blacks are dying at a higher rate from diabetes than whites in virtually every major city in the nation. Researchers found economic inequality had the greatest impact on the disparity, followed by segregation. Other factors driving the disparity included lack of access to healthy foods and safe spaces for physical activity. Let's move on to infant mortality. This is data from the U.S. Department of Health and Human Services Office of Minority Health. It shows Blacks have 2.3 times the infant mortality rate as whites. Black infants are 3.8 times as likely to die from complications related to low birth weight as compared to white infants. And in 2017, Black mothers were 2.3 times more likely than white mothers to receive late or no prenatal care.
Well, that was Sarah French. Studies also show Black men and women remain underrepresented in the physician workforce. Coming up at 5 o'clock, we're talking to a husband and wife team here in Charlotte about the stigma of being Black doctors in white coats.